Hey everyone, welcome back. I always like to pick topics that I know will really resonate with you guys. And knowing your interest in mental health, I thought this would be right up your alley today. We're going deep into the world of early intervention for psychosis.
Okay.
But with a twist, we're not just talking about meds. We're going to really focus on the psychological approaches that can make a real difference for folks in the early stages of psychosis.
Sounds good.
So to guide us on this journey, we're going to be diving into excerpts from the book Psychological Interventions in Early Psychosis, a treatment handbook edited by John Gleeson and Patrick McGorry.
It's a fantastic resource.
Yeah, it really is. And one thing that really jumped out at me right off the bat was how the book kind of like doesn't sugarcoat things.
Yeah.
Talks about how current health systems often fail to get people with first episode psychosis into treatment fast enough.
Yeah.
And even when they do, the rates of recurrence and, deterioration are pretty concerning.
Yeah, it's an inescapable conclusion. When you look at the research, we're not doing enough to prevent the long-term consequences of psychosis. And that's a huge driving force behind all the amazing research and development of early intervention programs.
Right. It's like there's this urgency to get it right because the stakes are so high.
Exactly.
And that's where this book comes in.
Yeah.
It's not just about like slapping a diagnosis on someone and handing them a prescription. It's about a much more holistic approach, right?
Absolutely. I mean, medication is super important, but the book makes a really strong case for psychosocial interventions being like a central part of comprehensive care. It's about providing that humane foundation for ongoing care, preventing those negative consequences, and truly promoting recovery in all aspects of someone's life.
So it's not just about managing symptoms, but like really empowering someone to live a full life.
Exactly.
I love that.
Yeah.
So when we talk about psychosocial interventions, what exactly are we talking about? Like what kind of things fall under that umbrella?
Well, it's a pretty diverse toolbox. We're talking about things like cognitive behavioral therapy, CBT, brief psychodynamic therapies, family interventions, group therapy. Each approach has its own strengths and can be tailored to the individual's needs.
I'm already seeing like just in the intro of the book, they talk about like working with families using group therapy. It really sounds like a team effort, not just the individual with their support network too.
Oh, absolutely. Family support is critical, and group therapy provides that sense of community and shared experience that can be so valuable for someone who might be feeling isolated.
Yeah, totally. So, okay, this all sounds really promising in theory, but how does it actually work in practice? Thankfully, the book has some really cool case examples like the story of Chen in chapter 3. Can you tell us a little bit about her?
Sure. So Chen is a young woman in her early 20s, and she's struggling with, depression, anxiety, social withdrawal, even having thoughts of suicide. And she also has a family history of mental illness. So it's a pretty complex situation.
Yeah, a lot going on there.
Yeah. And one thing that I found really interesting was how the book describes her therapists using a modular approach to treatment.
Oh, yeah. Tell me about that.
So it's not just a generic one-size-fits-all plan. They really try to tailor it to Chen's specific needs.
Okay.
They focus on different modules like stress management, dealing with positive symptoms, negative symptoms, and depression, other co-occurring conditions. And they use, a really thorough assessment to figure out which areas need the most attention.
So it's like they're kind of like creating a custom treatment plan.
Exactly. And they work collaboratively with Chen to choose the modules that, best suit her needs and her own perspective on things. It's not just the therapist dictating what should happen.
There's a part where Chen's therapist asks her about her brother's experience with psychosis. And I thought that was such a smart way to kind of open up the conversation about mental illness without making Chen feel like she was being singled out or judged. It's like, hey, this is something that affects people. I mean, let's talk about it.
Absolutely. It builds trust and rapport and, really paves the way for a more open dialogue. I think it's just a great example of, meeting individuals where they are.
I love that. And this emphasis on understanding the individual's experience also connects to like all the different approaches the book discusses.
Yeah.
And one that takes up a lot of space is cognitive behavioral therapy, or CBT.
Yeah.
I'm always curious to hear how CBT actually works like in the context of psychosis.
Yeah, it's a good question.
Because I think there's sometimes a misconception that it's about like telling people their experiences aren't real.
Right. No, it's not about that at all.
Yeah.
CBT for psychosis is really about helping people make sense of their experiences by understanding the connections between their thoughts, feelings, and behaviors.
Okay.
It's about exploring alternative explanations for those experiences and, testing them out and seeing what happens.
So it's more about providing like a framework to examine those experiences rather than just dismissing them.
Exactly.
That makes a lot of sense. So can you give me like a concrete example of how that might play out in therapy?
Sure, so imagine someone's dealing with paranoia, like they're convinced the government is spying on them. A CBT therapist might help them explore alternative explanations for those beliefs.
Uh-huh.
Maybe they've been reading a lot of conspiracy theories lately or watching spy movies,
Okay.
and then they can actually test out those explanations, maybe intentionally leave their phone at home for a day and see if anything happens, just to kind of see if their fears are actually grounded in reality.
So instead of arguing about whether the government is actually spying on them, you're shifting the focus to things they can control,
Right.
like their media consumption or their actions.
Exactly. It's about empowering them to be their own detective in a way.
I love that. And this focus on understanding the individual's experience
Yeah.
is also really central to another therapy called COPE,
Yeah.
which stands for Cognitively Oriented Psychotherapy for Early Psychosis.
That's right now, CBT often focuses on specific symptoms or beliefs, but COPE takes a broader approach. It's more about helping people adjust to the experience of having psychosis and develop a healthier self-perception. Imagine being diagnosed with psychosis. It can be a real blow to your identity.
Yeah, for sure.
So COPE uses techniques like normalization and narrative reframing. Normalization helps people understand that their experiences, while unusual, aren't entirely uncommon, and that lots of people find ways to live meaningful lives despite psychosis. And then narrative reframing helps them kind of reinterpret their life story.
Yeah.
Incorporating their experience with psychosis as just one chapter, not the whole book.
It's about recognizing that a diagnosis doesn't define you. It's just one aspect of your life.
Exactly. And this reminds me of a case from the book, The Story of Jonathan.
Oh, yeah. Tell me about Jonathan.
So Jonathan's a young man who's struggling with delusions and marijuana use. He believes that his thoughts are being broadcast on the radio, and he's withdrawing from school and his social life.
Wow.
Now, what's fascinating is how his therapist using COPE didn't immediately jump into challenging his delusions.
Oh.
Instead, they started by exploring how marijuana might be contributing to his symptoms.
So they're acknowledging his experience, but also gently guiding him towards understanding the role of substance use.
Exactly. And that leads us to another really important aspect highlighted in the book, substance abuse, particularly cannabis use.
Yeah, that was something that really jumped out at me. The book doesn't shy away from that at all.
No, not at all.
It's not just about treating the psychosis in isolation, right? You have to look at the whole picture.
Absolutely. Chapter 8 was really eye-opening. It highlights the alarming prevalence of cannabis use among those with first-episode psychosis and how it can worsen symptoms, increase the risk of relapse, even interfere with reaching those important life goals.
Oh, yeah. I remember that stat, a 5-fold increase in relapse risk for those who continue using cannabis. That's huge.
It is. It's a serious concern, and it underscores the need for interventions that specifically address cannabis use, as part of psychosis treatment.
So it's not just about saying stop using. It's about understanding,
Yeah.
the role it plays in their life and finding ways to manage it effectively.
Exactly. And it ties back to that idea of individualized care recovery is complex. It's not a one-size-fits-all solution.
Yeah, it really feels like we're starting to see how all of these different pieces fit together. It's not just about treating the individual symptoms in isolation.
Right.
It's about understanding the whole person, their environment, their choices,
Yeah.
and providing support on all these different levels.
Yeah, I think that's a great observation. It highlights the shift from a purely symptom-focused model to one that really emphasizes understanding collaboration and empowerment.
And this reminds me of something else that really struck me in the book, the discussion of relapse prevention.
Okay.
I think that's a topic that can sometimes feel a bit daunting, but the book presents it in a way that's actually quite empowering.
Absolutely. I mean, relapse prevention isn't just about avoiding triggers.
Right.
It's about building resilience and coping skills.
Okay, so walk me through this. What are some of the key strategies that the book highlights for relapse prevention?
Well, it's a multifaceted approach. Medication adherence is crucial, of course, but it's only one piece of the puzzle.
Right.
It's also about early identification of warning signs. Each person might have different triggers or early symptoms that signal a potential relapse. So recognizing those early on is key.
So it's about self-awareness and knowing your own patterns.
Exactly. And beyond individual awareness, family education and support play a huge role. By understanding those early warning signs and knowing how to respond, families can provide invaluable support and help prevent a full-blown relapse.
It's about turning that support network into like a active part of the recovery process. I like that.
Yeah.
But what are those times when, despite everyone's best efforts, relapse does happen?
Right.
What does the book say about managing those situations?
Well, it emphasizes that, relapse shouldn't be viewed as a failure. It's a setback, yes, but it's also an opportunity to learn and adjust the treatment plan. It might signal a need to revisit medication, explore new coping mechanisms, or address any unresolved issues that might have contributed to the relapse.
So it's about turning a potentially negative experience into a learning experience. It's
Exactly.
about adapting and evolving the approach rather than giving up.
Exactly. And that focus on learning and adaptation is also really crucial when addressing another difficult but important topic, suicide risk in early psychosis.
Yeah, that's something the book definitely doesn't shy away from.
Yeah, not at all.
It's a heavy topic,
Huh.
but I appreciate that it's addressed head on.
Yeah, it's unfortunately a reality for many individuals experiencing psychosis, and, ignoring it wouldn't do anyone any favors.
Right.
Chapter 10 really dives into, the prevalence of suicidal thoughts and behaviors in this population and stresses the importance of early detection and intervention.
So what does early intervention look like in this context?
Well, it involves being really vigilant for signs of distress, hopelessness, or suicidal ideation. It's about creating a safe space for open and honest conversations about these feelings and ensuring access to mental health support and crisis resources.
It's about providing a lifeline, someone to reach out to when things feel overwhelming. And this kind of connects back to that whole person approach we were talking about earlier.
Hmm.
It's not just about managing symptoms, it's about supporting someone's overall well-being, their emotional health, their safety.
Absolutely. Recognizing that interconnectedness of mental and emotional health. And this kind of brings me to something that's often overlooked in more traditional treatment approaches negative symptoms.
You're talking about things like apathy, social withdrawal,
Hmm.
lack of motivation.
Right.
I remember the book highlighting how these can sometimes be even more debilitating than like the more obvious positive symptoms like hallucinations or delusions.
Exactly. They often fly under the radar, especially in the early stages, because they're not as dramatic or disruptive, but their impact on someone's life can be profound.
Yeah, there's a quote from the book that really drives this point home. It says, their lives become progressively more limited, their relationships more impoverished, and their world at one time full of possibilities is now barren and devoid of hope.
Wow. That's heavy.
It is, and it really highlights why addressing these negative symptoms is so crucial. These symptoms can significantly impair someone's quality of life
Yeah.
and their ability to function in the world.
Yeah.
Make it difficult to hold a job, maintain relationships, or pursue their goals.
It's like a slow, insidious erosion of someone's potential.
Yeah, that's a great way to put it. And often these negative symptoms are actually present even before the positive symptoms emerge. So recognizing them early and incorporating specific interventions to address them can be so important in shaping the course of someone's recovery.
So we've talked about a lot of different approaches from CBT and COPE to family interventions and relapse prevention. But one thing that really stood out to me was the chapter by Rufus May, a clinical psychologist who himself experienced psychosis.
Oh, yeah?
It adds like a whole other dimension to the conversation, right? It absolutely does. Rufus May's perspective is invaluable. Having been on both sides of the equation as both a patient and a clinician, he brings this depth of understanding that's really hard to replicate.
Okay, so what are some of the key takeaways from his chapter?
Well, he emphasizes the importance of seeing each person's experience as unique and meaningful.
Yeah.
It's about moving away from that purely diagnostic lens and recognizing that there's a person, a story, a whole life behind the label of psychosis.
It's about humanizing the experience, seeing the individual, not just the illness.
Exactly. And he also challenges the traditional focus on limitations.
Yeah.
Instead, he advocates for a focus on hope and recovery. He really believes in the power of individuals to heal, to learn to grow, even in the face of significant challenges.
His perspective seems to align perfectly with this whole shift in approach that we've been talking about,
Hmm.
this move towards empowerment and collaboration. It's not about dictating a treatment plan. It's about working together, recognizing the individual's strengths and supporting their journey towards recovery.
That's a perfect summary, and I think it's a message that resonates not just with clinicians, but with anyone who's been touched by a mental illness, whether personally or through a loved one.
It's a message of hope, resilience,
Mm.
and the power of human connection. It's a reminder that even in the darkest of times, there's always a possibility for healing and growth.
Beautifully said, and I think that's a perfect segue into the final part of our deep dive, where we'll explore how all of these ideas translate into real-world practice and what the future holds for early intervention in psychosis.
Okay, so that sense of hope is really powerful. But, part of me wonders how all of this amazing theory actually translates into real-world practice. Like, it's one
Yeah.
thing to read about these approaches in a book, but are they actually being implemented, effectively in our current mental health system?
That's a really important question, and it's something the book actually addresses head on. There's a whole chapter dedicated to the challenges and strategies for implementing these psychological therapies within early intervention services and gets real about the barriers that exist.
Okay, so let's talk about those barriers. What are some of the biggest hurdles preventing these approaches from being more widely adopted?
Well, one of the biggest challenges is this gap between research and practice. Just because a therapy shows promise in a controlled research setting doesn't mean it easily translates into a busy, under-resourced clinical setting.
So it's one thing to demonstrate effectiveness in a lab, but quite another to make it work in the real world, where therapists are, juggling huge caseloads and limited resources. That makes sense. What else?
Training is another big one. Mental health professionals need specific training and ongoing supervision to really develop the skills to deliver these interventions. Effectively, it's not enough to just read about them. It requires a specialized skill set.
So it's not just about good intentions. It's about equipping therapists with the knowledge and tools they need to actually make these interventions work.
Exactly.
And that takes time, resources, a commitment from training institutions and mental health organizations.
It really requires like a system-wide shift in priorities and funding. We need to invest in training supervision and ongoing support for clinicians if we want to see these evidence-based approaches become the standard of care.
It sounds like a pretty big undertaking, but if we're talking about truly revolutionizing the way we approach early psychosis, maybe that's what it takes, right? A systemic overhaul.
That's what the book argues for. It advocates for a more strategic approach to implementation, one that involves careful planning, ongoing evaluation, and a real commitment to overcoming those systemic barriers.
So it's not just about individual therapists trying their best. It's about creating a system that actually supports and values these approaches.
Exactly. It's about fostering a culture of early intervention where these evidence-based practices are like woven into the fabric of mental health services. And it's about recognizing that investing in early intervention can actually save money and improve outcomes in the long run.
Okay, I have one last thought before we wrap things up. This might seem a bit out there, but throughout this whole deep dive, I've been struck by how relevant these interventions for early psychosis seem beyond just that specific population.
Oh, interesting.
It's like the principles behind them, understanding, collaboration, empowerment, those feel applicable to like anyone facing challenges, maybe even just navigating the ups and downs of everyday life. What are your thoughts on that?
I think you're onto something. The core principles underpinning these therapies definitely have a much broader reach. That emphasis on understanding someone's perspective, collaborating on solutions, fostering a sense of agency, those are valuable in any context.
It's like we're talking about building resilience, coping skills, and a sense of self-efficacy. Those are qualities that benefit everyone, regardless of whether or not they've experienced psychosis.
Precisely. And even many of the specific techniques used in these therapies, like stress management, cognitive restructuring, problem solving, those can be helpful for anyone facing difficult situations. It's about equipping people with the tools to manage their emotions, challenge negative thoughts, and navigate life's complexities.
Wow, that's a really thought-provoking way to end this deep dive.
Yeah.
It leaves me feeling hopeful, not just for the future of early psychosis intervention, but for the potential of these approaches to make a positive impact on a much wider scale.
It's been a great conversation, and I think the takeaway here is that the field of mental health is constantly evolving. We're learning more all the time about what works, what doesn't, and how we can better support individuals on their journey towards recovery and well-being.
I couldn't agree more. Huge thanks to you for sharing your expertise and insights with us today. It's been an incredibly enlightening journey.
My pleasure.
And to our listeners, we hope this deep dive has given you a better understanding of the complexities and possibilities of psychological interventions for early psychosis. It's a field full of promise, and we're excited to see what the future holds if you're interested in learning more. We highly recommend checking out the EPPC website. They have some great resources on a variety of topics related to early psychosis, including copy therapy and other interventions we discussed today. We'll include a link in the show notes. Thanks for joining us, and we'll see you next time for another deep dive.